you so much for that. It is time now for Medical Rounds. Pancreatic cancer in general is becoming more prevalent. Most recently, some high-profile personalities, such as Alex Trebek and Justice Ruth Bader Ginsburg, lost their battles with pancreatic cancer. Dr. Bret Schipper is the chief surgical oncologist at Hartford Hospital. Doctor, now, thank you so much for being with us this noontime. How has COVID-19 impacted the diagnosis and treatment of pancreatic cancer in the past several months?
Well, thank you very much for having me. I think, COVID-19 has certainly put a stress on the healthcare system, but here at Hartford HealthCare, we've done a great job at still being able to offer the cutting-edge care for these complex cancer patients in the setting of COVID-19. Even through the first wave, I still continue to operate on patients with pancreatic cancer, and we've continued to get them through the spectrum of care that they need to ensure good results.
Who is at risk most for pancreatic cancer?
So pancreatic cancer can really affect anybody. There's the general population who may have, no risk factors can certainly get it, but there are certainly higher risk factor patients who may have certain genetic mutations such as BRCA or a strong family history. Those patients are certainly at higher risk, and we do have programs here at Hartford HealthCare where we are watching those patients closer, surveying them in a more timely manner to hopefully pick up any new cancers that they should develop to try and help them beat the disease.
I know during COVID and during the past, 7 or 8 months, people have been kind of reluctant to go to see their doctors. What can you say about this? What's a warning that you can give folks about this?
Sure. So one of the problems with pancreatic cancer is sometimes there are no good warning signs. Unfortunately, unlike breast cancer or colon cancer where there's mammograms or colonoscopy, we have no good screening for the general population for pancreatic cancer. However, there are certain signs that you can get, such as jaundice or yellowing of the skin or eyes, clay-colored stools, dark urine, or abdominal pain. If any of those symptoms should occur, you should immediately see your healthcare provider for further evaluation.
And what does the screening process actually entail? Is it a blood test or imaging?
So usually it starts with some imaging, either a CAT scan or MRI. That gives us a good look at the pancreas to determine if there is anything there of concern. If we do see something concerning, the next test that's frequently done to get a diagnosis is what's called an endoscopic ultrasound, where a scope is put down through the mouth into the stomach, and using an ultrasound probe on the end of the scope, they can look through the stomach at the pancreas and give us a very good look at the lesion, as well as be able to biopsy it to make the diagnosis.
All right, Dr. Schipper, thank you so much for being with us from Hartford HealthCare. We appreciate it. And for more information, visit hartfordhealthcare.org/